also different for the healthcare. Statistics was not also in our favor. If you check the doctor ratios to patient ratio that we have in Nigeria is 3.8 to 10,000, right? Where the global standard says is 1 to 1,000, right? So already scarcity of doctors. If you also check level of investment too in Nigeria, that was also not very favorable because our level of investment was still very poor. And you have a lot of patients who were paying directly from their pocket to access healthcare. If you also look at in 2021, I think the Nigeria healthcare space also experienced the highest cost in healthcare. That's 15.6%, which is the highest in 10 years. So that goes a long way to tell you that affordability of healthcare was very, very expensive in Nigeria, and so many people could not even able to afford it to get access to the quality of healthcare that they need. And coupled with COVID, now this was seeing a whole lot of things. Revitalization of the healthcare facilities where you have in Nigeria, and also having the players in the healthcare system, like the consumers, the payers, and even the providers. They were totally caught unawares, right? From my own standpoint, where we help organizations to digitalize their process to ensure that they're able to provide excellent healthcare to consumer, we discover that most of them were not even digitally ready. There's something about digitalization, which is not just about the technology. You need to be able to have the backbone that can effectively help you to support the underserved market or the people that you're trying to serve. They were not ready. People didn't have the right, providers didn't have the right infrastructure. They didn't have the right communication system. So in a way, to bring in solutions was very difficult. So even when they have the solutions, talent was also a problem to be able to utilize them to be able to serve to serve the market. So I think for me, going forward, where the healthcare we need to focus, it's quite obvious, just like the other speakers have said. Things around reliance in digital tech will be very helpful once they get their backend all sorted. Bringing in the solution would go a long way to address the challenges that you have in the market. Then another area where we play to help most of our customers that we provide a solution for is in the area of data. Now, data play a very huge role when it comes to the pandemic, because getting records, able to understand what was happening in the healthcare space was very difficult, and not many customers had have the right systems to be able to provide this data as when needed. And that's where we came in to be able to provide a system where they can collect data, and in a way to also help them operationalize their back office. So things around billing, reimbursements, and patient payments, supplies and inventory, patient demographics, health data, diagnosis and treatment. Now, all these solutions were solutions that were needed to be able to cater for the already burdened healthcare in a way to keep people away from the hospital when you attend to them with ease. Right. So on another thing, like I've said, which is around the data, it's important that going forward that the healthcare continue to take their data very serious. I appreciate the fact that Vashi already said that in our first presentation that she shared. Data is very, very key. Now, if you're going to be bringing intelligent solutions like AI, like ML, they all need to run on data. And if you don't have your backend sorted, you don't have the right data in place, then it becomes very problematic. Take, for example, one of our biggest clients, which is the Lay Hospital. That they have close to 15,000 patients visits in a month and up to 200,000 patient visits in a year. They sit a whole lot of data, and they run systems that we support, that we provided to be able to manage data across board. It was easier for them to bring in solutions like AI-powered analytics that help them to analyze data around imaging, and also help them to analyze data around mammography and all that, to be able to generate much more value for the customer. So for me, I think these are areas that healthcare needs to focus going forward, because the norm, it has come to stay. It's also very important that healthcare also understand that in every disruption, there's a new market that is created. Is either you're a net loser or you're a net beneficiary. Now, for them to come to be a net beneficiary, they need to leverage on data, and that's where we can support. Give you systems that can help you collect this information and make you ready for a lot of innovations that is coming on board. Thank you.
Thank you very much, Marcel. And Mark, so over to you.
Thank you very much.
Yeah, so Mark is the CTO of Afia Care, Nigeria, and he's also a tech entrepreneur, so he'll be speaking from a wide background. The same question, what innovations and lessons learned, and also what advice you have for people going forward. Sorry, before you start, please, if anyone has questions, please put them in the chat box so that once we're done, we can start getting the questions and answering. Thank you.
All right, thank you very much, Dr. Shinawo. As you know, Afia Care, we are a healthcare venture. So basically we invest into healthcare assets and with a mission to make healthcare accessible and affordable. Recognizing what the other speakers have talked about, there are quite a few similarities in terms of what they have done or the experience they've had during the pandemic and what we have done in Afia Care as well. So first of all, it's important to recognize that there is a massive infrastructure gap, massive infrastructure issues in healthcare delivery in Nigeria today. So for us, we felt in terms of innovation, rather than attempting to reinvent healthcare, our focus was to address those issues, first of all, that will make the lives of the healthcare practitioners a lot easier. So what we did was, we went back to the basics, basically. So it's like back to the basics, approach to innovation, focusing on introducing technologies that will make the workflow more seamless, make tasks easily completed, and also improve on the throughput of the practitioner. So we leverage technology. We implemented infrastructure to address the base requirement, making sure that we have the systems in place. And while deploying these technologies, we also ensure that the technologies are based on standards. For example, leveraging international standards like ICD-10 for codification, CPT, SNOMED, etc., to make sure the systems, once we start using them, we can obviously extend them and be able to integrate the system across with other partners in the future. So we also focus on integration as well. So, some of our systems where results are captured, or maybe tests are done, results are captured, we make sure we integrated those output into our EMR, for example, to make sure that there is a more seamless way of extracting the output from one system, which becomes an input into the patient's health record as well. So, so for us, it's about focusing on the technology that will allow our practitioners to be able to do more with less. We know that there's been a massive brain drain this last few years with the COVID pandemic, with a lot of doctors from Africa being attracted to the likes of the UK, US, etc. So for us, it's more important that we do more with the resource that we currently have, and the only way we could do that is to empower them, to make sure they have the technologies, to make sure those technologies are easy to use, such that the learning curve in terms of onboarding and picking up those tools are quite short. In terms of how healthcare organizations should prepare for the future, for us, I think what I would say really is that healthcare organizations need to adopt a proactive service-oriented approach. What do I mean by this? Proactive in the sense that there are technologies out there that could help in terms of engaging with customers, engaging with patients. For example, during the pandemic, there were instances where you just get a rush, on the hospital, you get a run on the hospital rather, with patients who have caught the virus, unfortunately, needing care, and everyone is, coming to the hospital at the same time. everyone is getting impatient, waiting for a GP to attend to them. So, but if you put systems like appointment scheduling, for example, as simple as it sounds, it helps you to streamline the flow of patients into the hospital. Also having simple messaging implemented such that you're able to inform your customers as things move down the workflow, helping them to notify them of events or actions that they need to take prior to coming to the clinic for consultation as well. Also, I would say leverage technology. Technology would help you do a lot. Make sure you put in place the necessary infrastructure, put in place the EMR, electronic medical record systems, health information systems, if you have call center solution to be able to take calls, attend to patients, telemedicine for virtual care, that's also super important and very useful these days. It helps the practitioners to do more. It saves patients time in terms of travel and the cost of traveling, and of course your facility is not overrun with people getting frustrated of not receiving care. Also, I would advise that you embrace standards. I've mentioned a few. Make sure the systems you are putting in place has these standards implemented within them to make sure the information being captured is reusable, and global. Also, of course, you need to create the right working environment, because at the end of the day, it's about the people, it's about skills, and there is a global competition for skills, and that competition is quite intense. Finally, I would say invest in people. So you've got the people, you need to invest in them, you need to train them, you need to constantly ensure that they are comfortable, and they're able to be their best, whenever they're at work. Thank you.
Okay. Okay, so I do have volume. Okay, thanks very much. Okay, we're waiting for Basula to join. Are there any questions? Anyway, I didn't know Vamchi is there. I have a question. If nobody else has a question. Vamchi, one of the things that we're thinking about, and many people are thinking about, are issues of valuation. And I think all the panelists talked about, the good old days of COVID. Now, post-COVID, what does that mean?
I think the valuations will be more realistic going forward. So it will be a lot more focused on the opportunities that the companies have going forward and the market opportunities, not just in terms of growth, but also what are the revenues and profits, and also the companies backing it. So I feel like the valuations would be tapered, because if we think about it, before, the valuations were pretty much based on plug the number, 20x revenues or 30x revenues, really not understanding the trajectory of the growth. I think now it will be a lot more conservative, and we cannot expect VCs to look at similar valuations going forward. What that means to entrepreneurs is actually think about when to raise funds and how much to raise as well, right? And that also gives us as entrepreneurs more discipline, I feel, to think about what are the key core areas, as all the panel speakers talked about, what are the key core areas that we need to invest into, from technology solutions to the core capabilities that we need to build to be able to grow over time. I don't believe the crazy valuations will come back anytime soon, but you never say never in the VC world. I think they will, but